This week's episode, we're going to go over the hip. Now, the hip is an area that is problematic for a lot of other areas in the body. And what I mean by that is we might not realize, but our lost motion at our hip, our lost mobility at our hip can be influencing the rest of our body to perform poorly. So a lot of us have lost our true hip mobility due to injury, due to micro trauma, micro stress, sitting in a chair every day in the same position without getting out of that position. You start to build changes in the hip that then prevent the hip from moving the way it should. And when that happens, it creates a cascade where other areas start to compensate, to pick up the slack, and then those areas start to have a domino effect of getting their own problems. So the hip's a very mobile joint, but because of our constant sitting position that we find ourselves in, we develop a lot of tightness. So that's muscular tightness in the hip rotators, that is capsular tightness, which is what kind of protects the hip joint, and that starts to change the way how we move the hip. And what we lose tremendously is what we call hip extension, or the ability for the hip to go into a posterior shift, and then we also start to lose our hip rotation. And the biggest area that you start to see a drastic effect in is that lumbar spine or lower back. If we start to lose our hip mobility, we then start to use our lumbar spine to kind of pick up the slack, get those extra few degrees of range of motion, and that can start to lead to more wear and tear in the lumbar spine. Consequently, if it's a muscular issue, once you start to get less efficiency out of the hip muscles, you start to then compensate in the paraspinal muscles of the lower back, and then also in the hamstrings, and a muscle here called the TFL. Now, we talked about the TFL previously in another episode when it comes to IT band and lateral knee pain. So that's one of the other areas that can be affected by a loss of hip function. So today I want to go over some simple strategies on how we can unlock our hip, how we can really help gain back that mobility that we've lost over the years. So let's go try some things out. Alright, so I have Dr. Tyler here with me, and so he's going to help demonstrate some of these exercises that we can start doing to really incorporate that lost motion. So what I have Tyler in here is what we call the 90-90 position, also commonly known as a shin box position. So he's an external rotation here of his right hip, internal rotation here of his left hip. Now this alone you can just use as a static stretch, just being in these positions and these end ranges to really help mobilizing the hip. But what he can do is he can then create more of a dynamic exercise by going into what we call the 90-90 transfer. So what he's going to do is essentially flip-flop on his hips to go into the opposite position for each hip. So Tyler, go ahead and transfer over here, making sure that as he does that, he's got a nice solid brace here in the core. And we can do about 5 to each side with a good hold. Breathing, always important. Okay. And let's do one more to each side here. Now, if you get any pinching with this, it just might mean you have a little bit more impingement, which you might not be ready for this exercise. So always talk to your chiropractor or PT. One more time, Tyler. And then what we can do from here is that we can also then have him keep in this position here, but then lean forward, pancake in half, and you can really accentuate that stretch there. So depending on what you're trying to achieve, and we've talked about static versus dynamic warm-up, so depending on what you're trying to use this exercise for will determine what you want to do. So for a lot of people, you might not be able to go to this right away. So what we can do is we can do some internal rotation lift-off. So what he's going to do is he's going to use this like a lever, and now he's going to use the bar here to help accentuate that internal rotation movement. Back down. And you can do repetitions of this, 6, 8, 10. And you're going to get a really good feeling here in that hip. Might feel very tight, but overall, great way to start improving internal rotation. So try that out. That might not be for everyone, all right? That shin box 90-90 transfer, that could be a challenging position. So we can regress from that, and what we can do is what we call the internal rotation walk around. So I'm just on a standard workout bench. Now this will be for my right hip. What I'm going to do is go into a knee bend position here. I'm going to really lock that foot into the bench by pushing into that bench. So what I don't want is gross rotational movement. That's going to be more lumbar spine. But what I want you to do is more rotate through the hips here instead of through the spine here. So rotating through the hips, you're going to feel that tremendously here. This would be a great capsular stretch. It's also going to help work on the lateral chain here. So here you can do, once again, static or dynamic, whatever you're trying to achieve. If this is before a workout, you want to do more dynamic, more repetitions. If this is after a workout or a cool down or after recovery, you can do more static stretching. Once again, static stretching, it's going to be long, low duration, longer holds. And if you're really trying to get into the capsule, you're going to need to do longer holds. If you're trying to get more of a muscular stretch, short duration is fine. But if you're trying to get into that non-contractile tissue of the hip capsule, you're going to need to hold that position a little bit longer, more time under tension to really get an effective stretch of the capsule. Once again, making sure you're not getting any pinching here. So lock in the foot, get a good brace through here, push that foot into the bench here, and then instead of spine rotation, think hip rotation to lock in to really stretch that hip and internal rotation. So 6 to 8 reps, try it out. So one of the things that we do here that separates us is we really work on not only the soft tissue, not only the SI joint, but really mobilizing that hip capsule. So the one technique we have here is what's called the Mulligan Technique, and for any of our patients, that's the seatbelt that we're using on you guys. So we have ways that we can have you do this at home if you can't get to the office, and how you can create that same effect. So all I have here is a row band that we wrapped around the post, and what I'm going to do is have you put your leg closest to the rib through the band, bring it all the way up to that femoral crease, get some good distance away where you can still stabilize. And now what we're doing is we're getting a distraction on that hip with our pigeon stretch that we've done before. So we're really working on mobilizing that hip with the use of the band here. The band is acting as a distraction. So if you're not getting good resistance, just move further away from the anchor point. And now you can take that same pigeon stretch or that same hip stretch to pull the muscle, but now you're getting a distraction on the actual hip joint as well. Messing with the angle will decide on what you're gonna need. Sometimes you might get more release or stretch, just straight knee to chest. Sometimes you might have to go more into a figure 4. So what I say is follow the tension. Wherever you're getting a really good release, that's what I want you to hold. You can then also go into active mobility with distraction here. So now we're getting that hip joint to move with the excessive help from the band. So with that, once again, static or dynamic, what are you trying to achieve? But really overall a great way on how you can help self-mobilize when you're not here at the office. So to take that stretch further, what we can do is get you into more of a dynamic position, more of a challenging position, the quadruped position. So same thing, that same legs through the band, I'm pulling it to the femoral crease there. Get a good separation from the band, making sure you're in line with the rig. So now as you can see, it wants to pull me towards the rig. So now I'm gonna have to stabilize through the core, but now that I got that hip distraction going, what I can do is bend the knee, pivot the hip, and do some internal rotation mobility here as well. And once again, now we're mobilizing that hip joint with the added distraction to really help loosen up that capsule. If you're getting the pinch, I'm going to reiterate, don't do these exercises just to do them, making sure that they're okay for you. If you are getting any pinch or discomfort, make sure you talk to one of us at the office, your other chiropractor, your PT, whoever you're seeing. So don't just do these exercises to do them, making sure that they're okay for you, that they're pain-free. These should overall be a great stretch, good mobility, but if you're getting sharp pinching pain, these are not the exercises for you. But go ahead and try these out, see how they come. So when we mobilize, right, we're gaining a new range of motion that we've lost previously. Now, it would be foolhardy to stop there. What we now need to do is create stability for our newfound range of motion, because your body's not used to it. So now we have to go into our stability exercises or our facilitation exercises. So making sure we get into our lateral chain exercises. So commonly, you've seen the lateral walks here, making sure that our toes stay forward and not outwards. If the toe starts to go outward, you're starting to engage other muscles. So making sure good, slow controlled movements And if you only got the floor space in your living room, it's all that you need. But the important thing here is keeping those toes straight forward. This is gonna really help start to engage that glute system to really help create stability for that hip. Same position without changing anything, what we can do now is we can go into what we call some hip marches to help strengthen that psoas. So the psoas or hip flexor is commonly thought of as just being overly tight. A lot of times it's also very weak. So we really want to make sure that we're stretching what's tight, but strengthening what's weak. So your chiropractor will help you decide which one you have. But a great strengthening exercise for the hip flexor, pelvis tilt here, bracing here, and going into some hip marches here. Now, if balance is an issue, what you can do, any kind of PVC pipe to help create better stability. If this is still a little bit too much for you, what you can do is do this from a supine position or a laying on your back position. And you can also work then on the eccentric lowering of that muscle. So for the hip, you might get a very, very, very specific burny sensation because these are muscles that you don't really get into a lot. So 6 to 8 reps should be good, a couple sets. And you can mess with the eccentric or lowering phase to really get a good strengthening exercise for that hip. So same band, what we're gonna do now is just getting into a distraction of this hip to really help with hip flexor release, but also for that joint to go into hip extension. A lot of times that ball of the hip joint has a hard time getting to the posterior part of the capsule. This band here is going to help with that. So I have it once again all the way up, the femoral crease. First movement what we're going to do is go into a posterior tilt. Just tilting the pelvis back, you're going to feel a tremendous pull through here, making sure that you maintain that tilt throughout the entire exercise. Tilt back, brace here, lean forward, maintaining that tilt. Now you're getting a hip flexor, proximal quadricep stretch, with also a posterior distraction of that hip joint. Here, if you're trying to do more of a dynamic warm-up, you can do pulses. But if this is after your workout, you can kind of get in here and just hold this for 45 seconds to a minute. If you're trying to get to the capsule again, you need to be more load under tension, so probably about closer to 2 minutes. So try that out. Make sure you're not getting that pinching, but the most important thing with this exercise is that we have that posterior tilt.